Oh, in my previous clinical rotation at one of the sites, I remember I cared for a patient with a history of congenital heart failure. This condition affected the heart's ability to pump effectively, which led to like fluid buildup in their lungs and body. What happened was the patient showed common signs of and of congenital heart failure. This included like shortness of breath and fatigue, especially when it came to activities. They had like shortness of breath and also showed some signs of physically like signs of edema in the lower extremities. After knowing these symptoms, uh, I realized how important they are because they indicate the fluid overload in their body and the decrease of their cardiac output. Um, One key intervention was monitoring their vital signs, especially with their blood pressure and oxygen saturation. This is important because the congenital heart failure can affect circulation and oxygenation throughout their body. I also helped monitor the intake and output of fluids, which is critical for preventing any more fluid overload. Let's see, another intervention I did. I administered medication such as like a diuretic, which would help like remove excess fluid from the body to reduce the edema and hopefully improve their uh, breathing. I also assisted with repositioning the patient because in a high Fowler position, the patient has an easier time of getting more lung expansion, which would help the patient's body absorb more oxygen. Um, Additionally, if I was to teach the patient, I didn't get the chance to, I would have taught the importance of having a low sodium diet to reduce the fluid overload. Also, advise them to take like their medication, like diuretics, to help treat their congenital heart failure. And I would also monitor for any sort of worsening symptoms like an increase in swelling or shortness of breath, which would actually help the patient manage their condition like long term. Let's see. One example I used the nursing scope of practice decision tree was medication administration, where I was unsure if I could independently administer a new cardiac medication to the patient because I had not given anything like that in lab specifically. Um, where I applied my nurse's scope practice decision tree. Let's see, I had the medication within the scope practice of LPN, which was allowed by the clinical site. It's evidence supported. I had learned about the medication, but not yet like I've given oral medication but I haven't given specifically that medication. So I wasn't, and don't have enough practice, so I wasn't completely confident on giving it without supervision. So I wasn't able to perform it like independently. So the outcome was like I basically consulted my preceptor who supervised me during like the medication administration. This allowed me to be perform this skill safely and which ensured the patient's safety and like more experience will help build my confidence. Overall, I think this helped me better understand the cardiac condition of congestive heart failure um, by recognizing like important signs and symptoms and what I should look for in the future. Um, and it also kind of like showed me the importance of staying within my safe scope of practice. So, yeah, just so then the patient is safe. That's the main important thing.